This device is very interesting. We do a lot of it where I work. It works fairly well. It's used for focal epilepsies. So in seizures where there is one or two foci or even multiple foci, which means multiple areas of the brain are creating the seizures, but the seizures are coming from an area where we can't take out for whatever reason. Let's say it's important for memory, learning, speaking, vision, anything like that. If you can't take that part of the brain out to give the patient seizure control, we can put something in. That's where the RNS comes in. RNS works like a pacemaker on your brain. Basically, we have to figure out, so you have to do the full pre-surgical evaluation so we figure out where the seizures are coming from. And then we actually can implant electrodes in that area of the brain. Just like the pacemaker works on the heart, the RNS electrodes put out small electrical signals throughout the day in that area of the brain. And in doing so, they're going to modulate that electricity. So what does that mean? That means a small stimulation throughout the day. And the hope is in the long term, that small electrical stimulation will teach your brain how to not have a seizure, because epilepsy and seizures are electric, like dysregulation in the brain, right? So that small electrical activity that the RNS puts out can train your brain to not make bad electricity in a sense. So that's how an RNS works. There is more information at the website of NeuroPace, who are the manufacturers for RNS. So far, we've had good results, but of course, it's not for everyone. You think you're interested in this, definitely talk to your doctor. You should go to a big center that does a lot of RNS. I wouldn't just go to anyone. And lastly, before you even discuss any kind of epilepsy surgery, make sure you're a candidate, which means you've tried at least 2 seizure medications at good doses and have still poor seizure control.